Hello, I'm Sheryl McCarthy of the City University of New York. Welcome to One-to-One. I'm pleased to welcome Beth Finkel, State Director of AARP New York, to the program today. Those of us who are over the age of 49 remember receiving a letter welcoming us to join AARP and saying, "Oh no, I'm not that old, and I'm certainly not ready to retire." The national organization, which has almost 38 million members, bills itself as the largest advocacy group for older Americans in the country. Yet others have criticized it as being primarily a marketing organization that earns hundreds of millions of dollars by hawking products to older citizens, while at the same time enjoying tax-exempt status. What kind of organization is AARP really? What bona fide services does it offer to older citizens? How does it respond to its critics? And how prepared are older New Yorkers to meet the financial demands of retirement? Welcome. You know, most people think of the AARP as a national organization. I was surprised to learn that it has a New York presence. How big are you, and what do you do?
Well, in New York, we have 2.6 million members. We actually have 3 offices in New York, one here in New York City, one in Albany, and one up in Rochester that covers the western end of the state. And we have over 800,000 members right here in New York City.
Okay. So tell me a little about the history of AARP. It was founded in 1958 by a retired educator and by a guy who owned a lot of insurance companies. So what was the mission at the time?
Well, the founder was Ethel Percy Andrus. She was a retired high school principal from California. And after she retired, she went to go look up some of her colleagues and actually was trying to find one of the teachers who worked with her for many, many years, and went to the address that she's supposed to have lived at. She knocked at the door, and they said, "Oh, no, she doesn't live here. She lives around the back." And this teacher was living in a chicken coop. Literally a chicken coop in the backyard of this house. And so Ethel Percy Andrus decided to do something about it. And you have to understand, this was 1958, so this was before there was any Medicare. There was no Older Americans Act. None of those safety net pieces were in place. And so she founded this organization to be able to advocate for people at that point who were 60 and over, and then it was called the American Association of Retired People. Today, we are AARP, or AARP as some people like to call us. I work for AARP, the not-for-profit that everyone knows about, which is the 501c4. And our work has to do with making sure that Social Security will be there for us and for generations to come. Our work also is about Medicare and Medicaid at the federal level. There is no one else who fights for those programs like AARP, because we know that they are the literal lifeline to the majority of our members. Here in New York State, the average Social Security benefit is under $15,000 a year. A huge percentage of people rely strictly on Social Security. So for AARP, Social Security is the third rail. There is nothing that's more important. And so we are the only organization that I know that consistently goes out and fights for the future of Social Security to make sure that it's going to be vibrant and robust for generations to come.
There's the AARP Foundation. Mm-hmm. Tell me about that.
I'd love to. AARP Foundation is a 501c3. It both takes in money, but it also gives out grants, and I would suggest that people keep an eye on their website for the RFPs that come up on a fairly regular basis. Here in New York, the foundation is involved in so many things. One of them is hunger, because we know hunger among older adults is a huge, huge issue. So we've been involved for many years, both at the policy level, changing the policy in New York State. We were able to change the access to SNAP benefits to make sure that people are getting enrolled. There's a lot of stigma attached to people applying for food stamps, or as they're called now, SNAP.
That's what SNAP's called, okay.
Mm-hmm. And there's also barriers in terms of language, especially here in New York City where we speak so many languages. So AARP has been at the forefront of literally enrolling thousands and thousands of people on food stamps. We also have volunteers who go out and fill out tax for people for free. They're trained by the IRS. It's a partnership between AARP and the IRS. And they're all over the 5 boroughs, but they're across New York State, and many are multicultural, being able to work in language. And we know.
Are those services available just to members, your members?
Anyone.
Okay.
We're at senior centers, we're at libraries, we're at community offices, so that's that. There's also a lot of work that the foundation does for 50 plus workers. They do a lot of analyzing of best practices for employers to encourage more employers to hire 50 plus workers. We also, under the Older Americans Act, we have funds that come in and help people actually with entry-level jobs. So it gives them a minimum wage and then hopes to train them through those jobs to get permanent jobs.
Mm-hmm. How does one find out about those services? I had difficulty finding AARP New York's website. And so how does one find out about these things?
Well, we do have a website. I'm glad you brought that up. We have actually 3 different New York websites. We have the www.aarp.org/NY, and then we have the same thing with /NYC. And we actually have another website. If you have any viewers from Long Island, we have another website on Long Island. But if you just go to the www.aarp.org site and then put in the search for New York, they will come up.
Okay. There's the AARP Institute, which I understand holds some of gift annuity funds. The Legal Counsel for the Elderly, which is a Washington, D.C. program. Tell me something about that.
That's a great program. That's free legal services to people that need it in the community. It's a wonderful program run out of the foundation.
Okay, and it's absolutely free?
I believe so. I don't work in that program, but I believe it is.
Okay. The AARP Experience Corps.
AARP Experience Corps is also part of our foundation, and those are volunteers who go out and work in local public schools. Right now we work with the Community Service Society right here in New York, and we've got volunteers, I think, at 4 or 5 schools right now, mentoring young people, trying to help them with their schoolwork and help them get ahead. And we've got that all over the country, by the way.
Former U.S. Senator Alan Simpson described AARP as, quote, the biggest marketing operation in America and an organization whose practices are, quote, the greatest abuse of American generosity I witnessed in my time in the U.S. Senate, unquote. By one estimate, AARP earns close to $700 million a year in royalties from the insurance companies whose products it recommends. And it has been criticized for having a conflict of interest because it's recommending insurance products, but getting royalties from these insurance sales. Is there a conflict of interest there?
Again, I work for AARP for the 501c4. I do advocacy, I do outreach, and I do volunteer work and community service. I believe that what you've brought up are things that have been put to bed many years ago, and I think that AARP is fortunate that it is affiliated with that separate for-profit. But again, there's literally a firewall up between my work, the part of the AARP that I work for, and the products and services. So I really can't answer any of your questions about that.
Political and lobbying work. I assume that your organization isn't, well, you suggested that you're involved in advocating for various kinds of issues and legislation. Tell me about some of that.
I'd love to. We just recently got past the CARE Act here in New York. The governor signed it last week, which we were very excited about. And the CARE Act is because there are almost 3 million caregivers across New York State who are helping people stay in their homes, helping people age in place. And what we realized is that there's no support for caregivers. Where do they go to for help? Where are the home and community-based services for them, and who can answer their questions? Because we know AARP surveyed people for so many years, and it almost always comes out the same, that 9 out of 10 people would prefer to age in place in their own homes. And so one of the ways that we see that happening is because they have this informal support service, right? They've got their daughters and their wives and their husbands and their grandsons, and it takes a whole village, right, that comes together and helps people remain in place. But what happens when someone goes in the hospital and needs care? And then when they come home, what are they going to do? And so we put this law together, which we're very, very excited about, because for the first time, when you enter a hospital, the admission process will include the admission director having to ask you directly, do you have a caregiver? And then you can optionally decide that you want to identify someone or not. Let's say you do, and you identify your daughter. And so before you get discharged from the hospital, it'll be incumbent upon the hospital to notify that caregiver that you're going to get discharged, and then also go over the care plan with that person. And if some of the care is something that they need training on or they're not comfortable on, then the hospital will have to provide training. So this works on so many counts. First of all, it ensures a little bit more that when you go home, you will have the best care possible in your home, that people will be there who are knowledgeable and are confident in what they're doing. So we're very excited about this, and we think it's going to make a big difference. We think it's going to make a big difference in the recidivism rate of how many people end up going back in the hospital after they get discharged because they don't get the care that they need.
Right. Well, one issue, I mean, suppose you do have a daughter or son, and there you are responsible for some of your care, but they have to work. And I know that, one of the big issues nationally is that Medicare does not provide any payments for home care aides.
People are not.
And, which is one reason why so many people wind up in nursing homes, because Medicaid, low income people, because Medicaid will pay for that.
It's the payer of last resort, and people end up spending all their income. You're absolutely right. And then who pays Medicaid?
Right.
We all do. So we have to figure out ways that, because we know, number one, people want to live out their days in their homes.
Right.
And then second of all, it's fiscally so much more responsible to be able to provide that.
Right.
It costs on the average $3,000 to $4,000 a year to provide some home care to keep people out of an institution. And in New York State, it can run you anywhere from $100,000 to $200,000 to be in a nursing home.
Is there any kind of coverage in New York? I had heard that New York was more liberal than some states, that Medicare does.
There's some home care services that you can get through Medicare, but it's limited.
Right.
There's also programs through ISEP programs, and here in New York City, if you call 311 and ask these questions, they can put you directly in touch with the New York City Department for the Aging, which has excellent information and referral services.
Okay. So the CARE Act was one area where you were very much involved. What are some of your other?
Well, we got more money this year, more money than ever before. Over $50 million in the state budget went into Respite Care, which we're very excited about, because, again, this helps people who are caring for those who are in their home. We never had this before. So especially for people who have dementia, people need a break. They want to do the right thing by their family members or by their neighbors or whoever, and we need to be able to give them a minimum of support so that they can keep on going.
So what they get?
What they contribute is equal to over $32 billion a year. If we had to pay for the services that these caregivers are providing, it would be over $32 billion to New York State to actually pay the money for it. So again, it's in everyone's best interest to support these folks.
So what kind of respite care can you get in New York now?
Well, there are places that you can go to. If you call the Alzheimer's Association, they have great services for this. And again, if you call 311, they can tell you what's in your community. Okay.
We're going to take a break. Then we'll be back with more with Beth Finkel, State Director of AARP New York. Welcome back to One to One. I'm Sheryl McCarthy of the City University of New York, and I'm talking with Beth Finkel, the State Director of AARP New York. In a voter survey of New York State voters, I think ages 35 to 69, earlier this year, AARP found, among other things, that a majority of baby boomers and Generation Xers, those are what people just younger than the baby boomers?
They are, and the first Gen Xer turned 50 this year.
Okay.
The youngest among them is turning 36 this year.
Okay. But you found that a majority of both baby boomers and Generation Xers plan to leave New York City when they retire.
And plan to leave New York State, as a matter of fact.
New York State.
Yeah, we actually asked them if they are thinking about leaving New York State when they retire.
Okay.
And you're absolutely right. The numbers actually in New York City were 66% of Gen Xers said that they were likely to retire elsewhere. And that's very concerning.
I assume that, is that for financial reasons?
We believe so, that yes, the affordability factor in New York, which we're all aware of, high cost of housing, a lot of Gen Xers and baby boomers have student loans, and if they don't have them for themselves,
even still their own student loans.
Oh yes, very much so. And also they're worried that they're going to have them for their children, and it's very hard to save for retirement when at the same time you want to make sure that your children get a good start in life. So there's a lot of issues around this. So they're not comfortable that they've saved enough for retirement. And they're very, very worried about having access to retirement savings, especially at the workplace. When we think about, boomers, but even so more Gen Xers, it's not like our parents who, for the most part, a lot of them had defined benefit plans or an old-fashioned pension.
Right.
We're seeing less and less of that, just as we're seeing less and less of people working for one company for a very long time.
Right.
And so what happens if they don't have a defined benefit plan? Then we hope that they have a 401k. But in fact, we're seeing less and less of that. One of the research that we did this year, we found that 52% of all New Yorkers who work in private industry do not have any access to either a defined benefit plan nor a 401k in the workplace. And we also know that if you have it automatically deducted from your paycheck, that you are 15 times more likely to save for retirement.
Okay.
So that 52% represents 3.5 million New Yorkers who have no access to having that automatically taken out of their paycheck.
They don't have access to it? They can't?
Well, they don't. There's nothing in their companies. There's no defined benefit plan. There's no 401k. That automatically gets deducted from their paycheck. So we've been thinking a lot about what policy changes could take place to see if we could make that happen. And so we've been working on legislation called Work and Save. We're very hopeful that the governor might put that in his budget for this coming year. And that would be a state-facilitated savings program. So very much like a 529, where people can automatically take money out and put it away for their future student tuition. This would automatically take it out of their paycheck, but it would go toward their retirement savings.
And it would be taken out by the state as opposed to private employers?
The employer would take it out of the paycheck through a payroll deduction.
Right.
But the fiduciary, there would be no fiduciary responsibility to the employer. Nor would they have the normal administrative costs that a regular 401k would cause them. Because it would be state facilitated, it would be taken on by the state, and then the state could offer that program very much like the state now offers for people who work for not-for-profits. The state has a facilitated savings plan for people who work for not-for-profits in New York. We would love to see something similar to that for those 52% of New Yorkers who don't have access to a payroll savings deduction.
One is always reading articles about how people should start saving for the retirement in their 20s and their 30s.
That's right.
And I mean, it's a great concept, except people who are in their 20s and 30s have so many other things to pay for.
That's right.
I mean, they're trying to get settled, they're trying to get an apartment, they're trying to maybe trying to buy a house, they want to travel. There are all kinds of things that they want to do that makes them not focus on, what they're going to have when they're 70.
And that's why AARP tries to impress upon people of all ages that you have to pay your future self first. And you really literally have to think of it like that. And yes, there's a lot of other...
Because nobody else is going to, apparently.
Well, that's true. And there's, for your discretionary income, you make choices. You make choices to go to the Starbucks every day, or you make choices to travel or whatever. And we hope that by raising this issue, by talking to people, and by telling them about what they can expect in the future. We have a great retirement toolkit on our website. You can go in and do a calculator and see exactly what you're going to need to retire. That's a good wake-up call for anyone. For some people, it might be reassuring, and they might go, okay, I'm going to be okay. But for a lot of folks, it helps them stop a second and think about what they're going to have to do to take care of their future self, because they're not going to want to be a burden on their children or anyone else. People want to live independently. We know that.
Well, good luck with that. One of the other things that you found out in your recent survey of New Yorkers is that 32% of those near retirement age are at the risk of retiring with incomes below the poverty line.
Isn't that crazy? Crazy.
That's amazing.
I know. The average savings, I think, in a 401k is $25,000. I mean, what is $25,000 going to last you in retirement? So again, this is really a wake-up call to folks. And if you just put a little away every year, there's that power of compounding. And that's why we're so hopeful that New York State government will take action on this, because every year that we delay is another year that people are not automatically having that money taken out, so that at the end of the day they can wake up as they're nearing their retirement and see this really a windfall waiting for them.
Yeah. But there's so many demands that are being made on incomes that seem to be shrinking. Overall, save for your retirement, buy long-term care insurance, which is quite expensive.
Yeah, well, that's a very interesting subject that you bring up, because there's been less providers for long-term care insurance, and it's very hard to pay for folks. Very hard. And you're right, what you said earlier, that people think that Medicare is going to cover it. And in fact, it does not. And it's a terrible feeling to make that call and find out, wait, all those years you thought Medicare was going to cover your long-term care, and it doesn't.
Yeah.
And that's why we have to figure out both ways that people can save for themselves. Probably is a public-private partnership that needs to be enhanced a little bit more. New York State actually does have a partnership program for long-term care, and I would suggest that people look into that. But that's not the answer for everyone. There are reverse mortgages as an opportunity for folks. If they haven't been able to save enough for their retirement, they can use their home. A lot of people don't want to use that because they see their home as something that they really want to pass on to their children.
Right.
And I understand that. But I think what we're saying most of all is that people really have to be informed consumers. People have to understand exactly what they're going to need for retirement. A few years ago, 2 years ago actually, Transamerica did a wonderful research on millennials, boomers, and Gen Xers. And they questioned them all about their financial planning. And one of the basic questions was, do you have a financial plan? Now, everyone knows that you can't get from A to Z or wherever you want to go if you don't have a financial plan in place. And that report found that only 16% of all the people they surveyed had ever taken pen to paper and tried to figure out any kind of a plan. Mm-hmm. So I think what we're trying to say most of all is be informed, find out exactly what you need to know, because you can't plan if you have your head in the sands and you're not really aware of exactly what you're going to need and how you're going to get from here to there.
Right. The notion of retiring at 65 seems to be more and more outmoded. A lot of older people want to keep working longer. A lot of them need to keep working much past that time. And yet, a lot of workers start getting pushed out of their jobs in their 50s. Is there anything that can be done to allow older workers to keep working if they want to?
Absolutely, and that's one of the things that AARP does in terms of educating companies about the value of the 50-plus worker. When you think about the institutional knowledge that 50-plus workers have, their reliabilities, every study that we've ever done talks about their reliability and their institutional knowledge, and if they start departing, who are they passing that knowledge on to? We also have to look at demographics, right? People are having less children, so there are going to be ultimately less people joining the workforce. And as that happens, the value of that 50-plus worker is going to get recognized more and more. But until we get there, people have to understand what an older worker brings to the workplace. The mentoring, the modeling of good working behaviors. But the bottom line is what we saw in this research that was over 20% of people said that they were never, ever going to be able to retire. And when they say
not going to be able to.
Not to be able to retire.
Right.
And that's a scary thing because I can't imagine a retirement plan is work till you drop. And that's basically what people are telling us. We can't allow that to happen. We have to jump in earlier in people's lives and make sure that there's a policy in place that when they get to that end date, that they don't feel like that they have to work till they drop, because they have been saving money all along the way, and it's hard. We know it's very hard. People don't have a lot of discretionary income. However, a little bit can go a long way. If you start early and you start socking it away, then hopefully you're going to have enough when you have to retire. And it's part of that, well, is it the four-legged stool now, where you've got your Social Security and you've got your Medicare and you've got your health care insurance and other things.
And you've got your part-time job at age 75.
And you might, because you're absolutely right. People want to be stimulated.
Right.
And it is very healthy for people to keep on working, provided you have that kind of a job that you can do.
Right.
But, I was just on my way over here. I was watching two guys unloading a truck, and they looked to be early 30s. And I'm thinking, wow, I hope they're saving for their retirement, because they were taking off big cases of soda, putting them on the hand trucks and like throwing these big cases of soda at one another. And I'm thinking, oh my goodness, I hope these guys have a plan in place, because they can't do this for the rest of their lives. There's just no way.
Mm-hmm. Mm-hmm. So are there any more programs, we get about a minute and a half left, that are available to New Yorkers that your organization offers that they should be looking into or taking advantage of?
Many. I'll just mention another one, which is Fraud Watch. We have a Fraud Watch network that people can go on our website and register for it, and it sends them alerts on frauds that are actually happening in their communities. And there's all different frauds going on all the time.
There's a New York Times article today about people who are having their houses taken fraudulently.
Did you see that? That's just horrible. But people are getting phone calls, and people are making believe they're part of the IRS. And if you just give me your Social Security number and some information, I can take care of what you owe the IRS. And you say, well, I don't know. Oh, yes, you do, ma'am. You do. Right. And so before you know it, you're giving away all this private information that then allows them to totally scam you.
So it's Fraud Watch.
Yep.
And they can find out about that on your website.
AARP.org, yes.
Okay. I'm afraid we're out of time. I want to thank Beth Finkel, State Director of AARP New York, for joining me today. For more information about her organization, go to its website at states-aarp.org. For the City University of New York and One to One, I'm Sheryl McCarthy. If there are any people you'd like to hear from or topics you'd like us to explore, please let us know. You can write to me at CUNY TV, 365 Fifth Avenue, New York, New York, 10016, or you can go to the website at cuny.tv and click on Contact Us. I look forward to hearing from you.